I now have the special honor to introduce our commencement speaker, Dr. John D. Craig. Dr. Craig is the Vice President for Education and Outreach at WNED Think Bright. Dr. Craig joined WNED Think Bright in September 2008 as the Director of Education and Outreach, serving our region, the state, and the national level on many public broadcasting system educational programs. Dr. Craig is a native of Western New York and has worked in the community for over 20 years at various educational institutions. He's a veteran of the U.S. Navy, serving from 1982 to 1988. While serving as the academic dean at Bryant and Stratton's Eastern Hills campus from 1992 to 1995, he entered the postgraduate program at SUNY at Buffalo. He completed his doctoral work at UB and received his PhD in Education Administration in 1999. Dr. Craig has spent years working and teaching in Western New York, supporting students, families, and educators, as well as community agencies in business and industry. He has taught in the graduate schools of education at Niagara University, Buffalo State College, and Duville College, and also for 13 years in the continuing education department at Niagara County Community College. WNED is one of the major regional forces for improving health and preventing disease and disability. Dr. Craig has been important, very important, in establishing partnerships with our school and opportunities for our students and faculty to connect with the community in important ways. I look forward to hearing his remarks today. Dr. Craig.
Good afternoon. UB Council Member Hayflick, President Tripathi, Dean Kozlowski, administration and faculty and staff of the School of Public Health and Health Professions, parents, family members, significant wives, husbands, and invited guests and children, and of course our graduating class of 2011. It's been my great pleasure to be asked by this university and this school to come back as an alumni to speak at commencement. It certainly gives me great pride as a native of Western New York to be an alumnus of the University at Buffalo. And I want to give a heartfelt thanks to the Dean and Associate Dean Lorraine Collins for extending that opportunity to speak to you today. I was both flattered and honored to be asked. Yesterday, one of my colleagues at the station sent me a link and wondered if I had delivered my commencement address, and sent me a link to a blog on commencement protocol. And there were 6 overarching principles on how to lead a commencement address. I was happy to know, reading through it, that 5 of the 6 I had done my homework on. The last 24 hours I've been working on the 6th one. I was asked today to really speak about 2 important public entities that have really been under the microscope in our country over the last year, and that is of public health and public broadcasting. Certainly this country has never seen greater challenges in the realm of public health, from chronic illness and environmental concerns to quality health in food and nutrition, obesity and cancer, to the notion that this generation and perhaps future ones may live, in fact, shorter lives than their parents and grandparents. It has certainly never been more important for the world of public health and the work of public health to be focused on its citizens. Whether we speak about local Western New York as a community, large urban centers, or rural America, the health concerns of these regions are vast and many times complicated. There are no quick solutions or fixes. The importance of having a key understanding of the research and practice in the public health realm today is vital. The experience, knowledge, and work of the graduates today and what they've endured over the past many years has been extensive, and their involvement on many important topics in personal and community health vast. May the work you find ahead today in public health be a compassionate one, and may you find that work well to the graduates. The mission and goals of the School of Public Health and Health Professions are to support disciplinary and interdisciplinary research, excellence in education practice and pedagogy, and the application of knowledge through service here at the University at Buffalo. More recently, the dean has really spent a lot of time focusing on the importance of community outreach and public service. His 4 words pretty much sum it up: let's do something together. This has been accomplished by allowing faculty and advisors to align students in community agencies, schools, and other associations to use their skills and abilities that they've gained here at UB and to put them into practice. It's an important element and skill for graduates to have, and one, more importantly, that employers are looking for. I'm sure that if the graduates have had such an experience, that it was appreciated, and your time, talents, and insights made a difference. When we do more, we become more. Always strive to do that little extra that the next person may not want to do. We become enriched today by not what we have, but by what others have seen that we have accomplished. Give back and stay connected to your community through your craft and abilities, both personal and professional. I've had the pleasure over the last 14 months to work with former, current, and future graduates of the school. They have been high-quality members of our work at WNED. I want to thank Amanda, Sarah, and future graduate Corey, and a former graduate, Janet. They are making a difference in the work we are doing at Western New York Public Broadcasting in the world of health and health engagement. Likewise, the goal of each graduate today towards these shared ends of service may in fact be differentiated on expectations. For graduates today, think back to when you first filled out your application to apply to this university, to the school, or to your degree program. When you put pen to paper to fill out that application form, or when you engaged that electronic key to fill out those applications, what were your expectations for this particular program, this school, and your career opportunities? Some of you may have changed career majors. Some of you have made changes in your opportunities that you've previously had. Maybe you thought health is a new realm. Maybe you've had an undergraduate degree in a different discipline. Have your goals and objectives for career been changed by your experience here at the University of Buffalo? What lies ahead in terms of real career opportunities? Yesterday, it was reported that the top 10 graduate opportunities in employability were in the areas of science and engineering. That was probably not the case 3 or 4 years ago when health and health careers seemed to be at the top of the heap. It is suggested today that to be fully employable in today's marketplace, that you may need to reinvent your opportunity. Being mindful of that pursuit and understanding that you'll need to be flexible and you may need to reinvent your own career opportunity. Your path towards career is not always a straight one, and most likely there will be some bends and corners in that pursuit. Always be entrepreneurial. It is, after all, your career and no one else's to decide. In 1959, WNED became the first public television station in New York State. According to Nielsen's data, in 2010, last year, WNED was rated the #1 public television station in prime time in the United States. Buffalo is in the top 51 markets in terms of television, in terms of its reach in our demographic. But yet our population base is significantly less than those of Atlanta, Chicago, and Phoenix, Arizona. People in Western New York value the importance of public broadcasting, and our programming. That #1 rating would certainly support that notion. In 2001, with generous support from the John R. O'Shea Foundation here in Buffalo, WNED was allowed the opportunity to develop a new digital media platform called ThinkBright. The goal of ThinkBright was to align television, web, radio, and community outreach services under a free community platform to engage learners wherever and whenever they sought support and information. Think Bright in 2007 moved to statewide integration as a way to offer to other PBS markets those services. Think Bright was an attempt to bring digital media services to almost every home in New York State outside of New York City. Recently, though, Think Bright's identity and services needed support when state funding for public television was reduced. As a result of creative ingenuity and innovation, we pushed for more relevant programming. Think Bright was rebranded in October of 2009 as Think Bright and Well, as a way to infuse high-quality health programming into our services. WNED in recent years has started to produce local programs with generous support from the American Red Cross, Blue Cross and Blue Shield of Western New York, the P2 Collaborative, and generous donations from underwriters and businesses in our community. More recently, we've submitted application and we were awarded funding from the Corporation for Public Broadcasting and continued support from the Oshai Foundation to partner with the University at Buffalo School of Health and Health Professions, as well as the P2 Collaborative, Erie One BOCES, Independent Health, to support a grassroots effort aimed at reducing childhood and obesity in the Near East Side of Buffalo. The zip code of 14204 in the Near East Side of Buffalo is 43%, which is almost twice the national average. This particular demographic in our city is suffering not only issues of obesity, but other chronic illnesses such as diabetes, cancer, heart disease, and certainly a lot of social disparities. The Live Well Project, as it's called, partners with local communities and the university and after-school providers to develop programming that is relevant and seeks to change ideas about what constitutes a healthier lifestyle. WNED has partnered with UB on many initiatives through the years, but none more than important than combating this fight against diabetes, chronic illness, and overall behavior towards quality health. The School of Health and Health Professions is assisting WNED with a comprehensive evaluation of our work in the community. And we hope to be able to show to other PBS stations in the system, as well as to the Western New York community, the sort of work public media is going to do to engage healthy change. I want to thank Drs. Collins, Dr. Scheider, and Dr. Wittig for their vision and support since we began this program in the late winter of 2009. WNED's role in the Live Well Project is to provide a framework to other public television stations on how they can invoke a health and wellness programming using public media, television, web, radio, social media, and outreach under one platform. And we do this by doing what public media does best, providing a balanced, relevant, and creative way to educate yourself and your family on overall health in the community. I thank the university and the school for stepping forward to assist us with this project, and I hope in the coming months we can make a difference to the people in this area of Buffalo. As a graduate of 3 different institutions, not to include my service in the Navy, I was always under the impression that hard work and persistence and dedication would win the day. What I've learned over time is that the time and where you find yourself makes a big difference as well. No matter how well you plan or how well you achieve, your decision to act at any given moment is a learned process. Pick your time based on what you gather as you move forward. You never know when an opportunity will strike. Don't always be settled or satisfied with your current state. Don't let it, whatever it is, dictate because you didn't recognize an opportunity. In this case, you never know what's around the corner or the bend and what will transpire in the coming day. So celebrate each day and have no regrets in what you did. In closing, I've taken an acronym of public health and developed some themes and some points to ponder for our graduates today. P, professional. Always strive to be professional in the work you do, no matter how insignificant it may seem at the moment. Universal. Think globally, but act locally in your work. You've been taught much about the importance of global public health research and application. Practice what you know works best for each situation you encounter. B, behavior. Realize that everyone has a different set of circumstances and beliefs. Behavior can be unpredictable, so be ready for anything. L, love. Love what you do and whom you do it for. I, individual. Understand that you are an individual. You can't change everything by yourself, but you can support change, one decision or action at a time. Courage. Have the courage to do what's unpopular. Just because the popular thing is X, it may not be your best or most logical choice. H, hope. Strive to give hope to all that you serve and who you work for. E, evaluate. Take time to review your steps and make changes that are reasonable. A, achieve. Set both short and long-term goals and work to achieve them, whether they are personal or professional. Live. Live life to the fullest. For some, life ends unexpectedly and unfulfilled. Do your best to live each day as it were your last. Truth. Be truthful to yourself, to those around you, and to those you work with. And finally, H, happy. A happy you is a healthy you, so take care of yourself. So to the University at Buffalo School of Health and Health Profession class of 2011, I impart my sincere congratulations and best wishes to you, your family, and your friends. I commend you on your personal and professional accomplishments to date. I know it was not always easy. So may the road rise to meet you. May you always have a warm place to call home. May your work in public health ahead, wherever it takes you, be a compassionate one. And may this university and school be proud of your efforts. Thank you and best of luck.
Thank you so much, Dr. Craig. Please accept this token. Thank you.